How medicines and alcohol affect you as you get older. As you age, your body reacts differently to medicines and alcohol than when you were younger. Understanding how medicines and alcohol affect you and knowing how to use them safely is important to stay healthy. Alcohol affects adults older than 65 more significantly than younger people. Even small amounts can cause falls and injuries, or worsen health conditions like high blood pressure, diabetes, or memory loss. It's also important to understand how alcohol interacts with medicines, as this can have dangerous side effects, such as drowsiness or dizziness. To stay safe, it's recommended that older adults limit alcohol to 1 drink per day or less, especially if you have health problems. Medicines can also affect you differently as you age. Your body digests and uses medicines more slowly, which can make them stay in your body longer and increases the risk of having side effects. Taking different medicines at the same time or while drinking alcohol can have serious consequences, including breathing problems, dizziness, or even medical emergencies. Always take medicines in the way your doctor told you to, and never stop taking them suddenly without speaking to your doctor first. If you have questions about whether certain medicines can be safely taken alongside other medicines or with alcohol, talk to your doctor or pharmacist. Some medicines, especially powerful medicines called opioids and benzodiazepines, which can help with issues like pain, sleep, and anxiety, can cause dangerous side effects if you take them at the same time. It is really important to make sure all your healthcare providers and doctors know about all the medicines you take. Ask questions when you talk to your healthcare providers to make sure you understand how to take your medicines safely. Taking medicines and drinking alcohol carries unique risks for older adults, and it's important to know the signs of an emergency. Taking medicines in a different way from how your doctor told you to, or drinking alcohol, can increase the likelihood of falls, injuries, and health problems. Stopping medication suddenly without guidance from a healthcare provider can also cause serious side effects. Recognizing the warning signs of a medical emergency, such as trouble breathing, severe confusion, loss of consciousness, or unexplained dizziness, is crucial. If you notice any of these problems, call 911 immediately. If you or someone you know has questions or concerns about alcohol or medicines, there are resources available to help. You can talk to your doctor or healthcare provider. You can ask your pharmacist questions about medicines. In Vermont, you can call Vermont HelpLink to ask for support with alcohol or medicines. Call 802-565-5465 and then press 1. When a person answers, say interpreter in English, and then say your language. You can also call the number 211 to find services near you in Vermont. When your call is answered, say interpreter in English, and then say your language. Then explain what you are looking for. Anyone over age 60 in Vermont can get help with many different issues from the Senior Helpline. Call 800-642-5119. If you don't speak English, you may need someone to help you leave a message saying that you need an interpreter in your language and saying your phone number. Then they will call you back with an interpreter on the line. Everything you say when you call these numbers will be kept private. Staying informed, following guidance from healthcare providers, and asking for help or advice when you need it can help protect your health and safety as you get older.